My guest this morning here on Jersey Magazine at 105.5 WDHA and 1250 WMTR is Dr. Jonathan Shearin. He's from the Tri-County Orthopedics, literally around the corner from the radio station. Dr. Shearin, good morning and welcome. I want to ask you some questions about, and I hope I'm pronouncing this right, I asked you ahead of time, Wallant, wide awake, local anesthesia, no tourniquet surgery. That sounds very involved.
Well, Jim, thank you so much for having me. I really appreciate it. So you're absolutely right. So Wallant surgery is something that we offer here at Tri-County Orthopedics. And what it is, it's wide awake, local anesthesia, no tourniquet surgery. So what that means for the patient is that you're awake during the procedure, and it's only with local anesthesia, so you don't get general anesthesia, you don't have to have an IV, and it can be done in the office. So you can drive yourself to the office, the procedure is done in the office, and then you can drive yourself home. The nice thing is you don't have to fast, you can have breakfast, you don't need an IV, you aren't getting general anesthesia, you can continue taking your own home medications. Most patients, no pre-assessment or clearance is needed. And it's something that is very desirable to a lot of patients who don't want to go to the surgery center. They don't want to go to the hospital. They like the idea of going to the dentist's office or going to the hand surgeon's office and having a fair number of procedures that we can do done right in the office. So to a lot of patients, Wallant hand surgery is very desirable.
What kind of hand surgeries are you talking about here?
So a wide variety, Jim. So at Tri-County Orthopedics, we have a procedure room that's in Suite 210 on our second floor that's made out for this type of surgery. And so we can do carpal tunnel surgery, which is a nerve surgery in the hand. We can do trigger finger surgery, where the finger is getting caught and is locking. We can do surgery for tendons. If tendons need to be repaired, we can do surgery for ruptures of tendons and also tendinopathy, so inflamed tendons. And also, any types of lumps or bumps on the hand or masses can be removed as part of wide awake Wallant hand surgery in the office. Another nice thing about the fact that it's wide awake, Jim, is that I can have an open discussion with the patient. So I can tell the patient what I'm doing if they would like to know. If they don't want to know, we don't have to talk about it. I can talk to them about instructions after surgery. So what to expect after surgery. So instead of just reading an instruction handout, which we do give them, we can say, okay, for the first 2 days, I'd like you to keep your hand elevated. These are the things you can do with your hand in the bandage after surgery. This is when the bandage needs to be removed. So I have this open conversation with them because, again, they're awake, they haven't had any anesthesia, and they will remember our discussion. So that's a nice advantage of this aspect of hand surgery that we offer at Tri-County Orthopedics.
How new is this?
It's fairly new. I'd say it's been around maybe 10 to 15 years. I think it's become a lot more publicized and advertised maybe over the last 10 years. It's another aspect of it. We don't need IV anesthesia. We don't need general anesthesia. And so you get lidocaine with epinephrine in your hand or in your finger. So your finger is numb or your hand is numb. And the nice thing about that is that you don't need a tourniquet. So what's a tourniquet? A tourniquet is like a blood pressure cuff. That's what we use for surgery at the surgery center or at the hospital. And you don't need a blood pressure cuff because the injection that I give acts to decrease the bleeding and to provide anesthesia. So that's a more pleasant experience for the patient. So I think local surgery has been around for a long time, but to be able to do it without a tourniquet and in this fashion is somewhat newer and has gained a lot of traction because it's desirable to patients who want to drive themselves to the office. They don't want to go to a surgery center, and we can still accomplish a fair number of procedures that are very common in hand surgery.
I'm thinking about this, and if I needed this, I'm wondering, boy, would I want to watch this? Can the patient actually watch what's happening?
That's a good question. If they want to, they can. We can pull down the drapes a little bit, and we can. And another, to that point, Jim, another aspect is if I do a tendon repair or if I do a release and I want to see how the tendon is moving or how the patient responds, I can have them do certain things. I can say, okay, I want you to move your thumb, or I want you to bend your fingers, and I can see how my release is acting on the patient. And sometimes it's beneficial that they see it because then they know what we were able to accomplish in the operating room. Sometimes they don't want to see it, and that's fine because there are drapes. But if they wanted to see it as a benefit to their rehabilitation, then they absolutely can.
One of the reasons I asked you that is I work, in addition to radio, I'm also a baseball coach. I do a lot of work with pitchers, and the subject of Tommy John surgery comes up very, very often. And I've watched numerous videos of that procedure, and I'm fine watching it. A few years ago, I had my knee replaced, and one of the guys who I was going to be doing my post-op care with said, do not watch a video of the surgery beforehand. I'm thinking, all right, I'll take his word for it. But I came across this video, doctor, of a Play-Doh knee surgery, knee replacement. And I've got to tell you, I was like, oh my gosh, this is what they're doing in there. And it's a good thing he told me not to watch the actual video. But I think with a surgery like this, I'd actually want to know, hey, what's he doing over there?
And that's a good point, Jim. As I said, we're now able to offer it at Tri-County Orthopedics, wide awake hand surgery in a procedure suite. It's very convenient. And I think those patients that are going to sign up for that want that, they want the ability to drive to the office. They don't want to have an IV. They want to continue their current medicine. They want to be able to drive themselves home and be able to really, you can participate in your whole day after the procedure because you've had no anesthesia. You are not altered whatsoever. Some of those patients who want to be awake, those are the patients that may be more inclined to see what I did or to look after I'm done to watch how their finger or their hand moves. So we do have that option. And the nice thing is I can talk to them about what to expect in the next week. When do I see them back in the office to get the stitches out? Whereas before we have to necessarily say that to their spouse, significant other, friend, family member who's with them at the surgery center, and we give them hand printed instructions. But now there's a lot more ownership that we can discuss with the patient so that they can kind of enter their post-operative rehabilitation with confidence and in stride.
Dr. Jonathan Shearin from Tri-County Orthopedics. If WDHA and WMTR listeners want to learn more about this, where can they go?
Absolutely. Contact my team and my staff at Tri-County Orthopedics. Our main office is in Cedar Knolls. I'm doing these procedures in the office in Cedar Knolls. We would be happy to see you in consultation, and so you can learn more about that.
And there are other offices as well. I do want to point out, I believe Bedminster, Rockaway, Jefferson, and I may be missing one.
Jefferson, Bedminster, Bridgewater, and Cedar Knolls.
Absolutely. There you go.
So we could do an evaluation at any of those. If we were to do the Wallant, the wide awake hand surgery in the office, it would be at the Cedar Knolls office.
Dr. Shearin, thank you very much for your time this morning. I've enjoyed speaking with you.
Thanks, Jim. Appreciate it. Have a great day.